Hello, it's Dr. Greg here. Today we're talking about coccyx pain or coccydnia. What tends to happen, people present to my office quite frequently after maybe having a fall onto their backside. It could be something trivial. They might be pregnant and there's a lot going on in changing and around the pelvic floor area. The pelvis is enlarging and the coccyx has been left out of place. So this joint function here, it's a very small joint, as you can see. This is the coccyx and it joins the sacrum. Now, while it's a small joint, it has a huge supply of nerves. All of these spindly things here are representing nerves. This huge nerve supply means that it's a very sensitive structure, so the slightest movement out of place can really affect the joint function in this area here and have a global effect on the whole pelvic function and the pelvic floor. It can also create agony for the patient, so you may not be able to sit, stand, get comfortable. You just cannot be comfortable, and it can really affect your ability to walk and move properly. In the worst case, it can actually have an effect on function within the pelvic floor itself. Bowel and bladder can also become involved. So as a chiropractor, my job is to move this coccyx back into a more optimal position so that the joint function is re-established, and this will in turn take the pressure off these nerves over time and allow the body to restore its normal joint function. Other treatment modalities tend not to be so successful in that they tend to focus on just deadening the pain, so putting some pain suppressants on these nerves here, but it doesn't actually address the problem coccyx, so the problem soon returns. There's also been some surgical attempts, but it is quite an invasive procedure. So we tend to trial a course of treatment to see if we can get some genuine results, and generally speaking we tend to do quite well with that one. So if you're feeling like you've got a pain in the backside, or you're just generally feeling uncomfortable, to get your lower back assessed and ensure that your coccyx is functioning properly, please call my office on 8942 1920.